My name is Julie Yankanich, and my mom, Lori Kazempel, was diagnosed with a malignant pheochromocytoma in 2010. She, for many years, had symptoms of menopause for 7 to 8 years. Night sweats, hot flashes, high blood pressure. She had very low blood pressure, so her blood pressure went to normal. She also had some irritability and mood aspects to it, and her family doctor always said that this was an elongated menopause. This went on for 7 to 8 years. Then she would always complain of kidney stones pretty much her entire adult life and flank pain. It wasn't until 2010 that she insisted on having a scan of her side because of the extreme pain in her flank that was becoming closer and closer together, the episodes. And when her doctor scanned her, he saw a large tumor that at the time they thought was on her kidney. Turns out when the doctors went inside to take it out, it was on her adrenal gland. And at that time, we were told that it had metastasized to her abdominal wall and her liver. And we were told that she had something called adrenal cortical carcinoma, which would only give her a couple of weeks or months to survive. It turns out when the pathology came back, it was a pheochromocytoma with metastases. So she started seeing a doctor at Penn, Dr. Stephen Keefe, ultimately, after seeing many doctors there. And she went through many different treatment plans. She started with MIBG treatment. She did 12 rounds of IV chemo. She did 2 different oral chemos. She did a clinical trial, which had bad side effects but was working, but she had to leave the trial because her skin was getting toxic, and she had bad side effects. And then ultimately she tried something called CAP-TEM, which is another type of chemo, and that really affected her liver in a negative way. And ultimately she went on hospice, and she passed away at home just last month.